My name is Dr. Michael Breen, and I'm here with Dr. James Kane Sr. and Dr. James Kane Jr. to talk about the beginnings and the evolution of bariatric surgery. And Dr. Kane Sr., you performed one of the first bariatric procedures in the Midwest.
Yes, in the Midwest, that's for sure.
How long ago was that?
Probably about 42 years ago.
You've been doing this for 40 years. How did you get involved in weight loss surgery?
Because of my association with patients in general, you would see the illnesses that obese patients have. Amputated legs, terrible shortness of breath, inability to walk, arthritis, heart disease, the diabetes was out of control. Mm-hmm. And you're looking at the patient knowing that most of that is happening because they're morbidly obese. They're 200 pounds over, they're 250 pounds over their ideal weight. Mm-hmm. And these all follow. They're morbid problems that come along with the disease. The National Institute of Health has finally decided that morbid obesity is a disease.
But you were operating on them, and what you felt like the underlying problem was still there?
Yes. Initially, there was nothing else to help them with their obesity except dieting, and the dieting is so poor in most cases from the standpoint of getting results for 5 years.
But 40 years ago, the idea of operating for obesity it was revolutionary.
Do you know some of that prejudice is carried on even up until today? That people would think, why don't they just stop eating and you wouldn't have to operate on them?
How do you feel about that?
Well, I think that's terrible because, as I say, NIH has decided morbid obesity is a disease. It's a disease that precipitates a lot of other diseases to develop after that.
You're right. People think of it as a largely cosmetic problem, but it leads to a whole variety of illnesses.
Yes.
Now, when you first operated, what did other surgeons think about you? I mean, 40 years ago, this was so new.
Well, to say I had mild opposition, I'm certain a lot of people thought I was off my rocker.
Mm-hmm. They still do.
Doing things. Why are you operating on an obese patient?
Yes.
Because they are obese. That is their problem. And the interesting thing about that, Michael, you only have to do a few, and immediately you see the benefits of it.
What do you notice?
Well, the patient is so much happier. They're able to get around. And they've been to their internist who says, I'm reducing your insulin 50%.
Yep.
I'm able to walk the stairs. I've had people come in and smile, and I'd say, Mary, why are you so happy today? You know, doctor, this is the first time in 15 years I've crossed my knees.
And that was an enormous moment for them.
That was a great moment for that person. And imagine all of the other better medical problems that come along behind it. When they can walk a flight of stairs. Mm-hmm. And then the discrimination starts.
Yeah, we don't blame people for their high blood pressure or for any of these other conditions, but we tend to see obesity as something people bring on themselves. And is that starting to change?
It probably has, but not very much. There are a lot of people yet in this world, and I'm sad to say even physicians in this world, that feel that much of this you brought on yourself. And a lot of that I don't think is true. I think these people have a problem where they just cannot get over it with dieting. And the only way you're going to help them, or they're going to help, or you're just going to let them die early, at 40 or 50 or 60, when they could live until they were 70 or 80, is to get a lot of weight off them.
You did this 40 years ago. It was almost unheard of. Now it is a major operation in America, totally accepted. Do you feel validated? How do you feel looking back?
Well, I'm just very happy. I'm very happy for the patients and the many patients that are now being treated, where the very few were being treated when myself and maybe a few other doctors in the country were doing things like this.
I know one of your patients, I think, was Jim Belushi's mother, or John Belushi's mother?
Yes, my mother.
Can you describe her experience?
Agnes, when I first met her, she lived in Wheaton, Her life was every night to put almost a tent over her head and walk a half a block up to a drugstore where she would stand behind the cash register for a couple of hours just to get some relief outside of her home, and then back. When I first met her, she came to the office and she said, "You know, the boys are opening in Las Vegas, or they're opening in New York, and they sent me first-class tickets to come down there and see them." She said, I'd say, "Agnes, you ought to go." And when you would see Agnes, you could see the anguish in her at that particular moment. Happily, after we did her bypass, and she lost a lot of weight, you could see, and she walked into the office with gold chains around her neck, big hats. You could see where the Bellucci is in her. You could see where the boys got it. Up till that period of time, she was just a very sad woman.
She really blossomed in her
terrible.
and you see that, I think, a lot, don't you? Where their whole personality is transformed.
Absolutely.
It must be so gratifying.
Families just do so much more together. When mother is able to get out, even out to the baseball diamond, without worrying about insulting her or causing her son or her daughter to be embarrassed.
It's like the lost person inside of them is finally able to come out.
You must see a lot of that. People who they hide themselves almost, they're so ashamed by their obesity.
They are completely different people from the beginning of our contact with them to roughly a year later. Their lives, it really is amazing. I mean, I've been doing this for myself for about 17 years, and their lives are completely topsy-turvy from what it was a year before. And they're the people that they used to be and want to be. But there is something about the barrier of obesity in our society that creates a situation that people just close up.
Now, Dr. Kane, you started 17 years ago. Were you influenced by your father?
I'd say a little bit.
Well, what was it that you saw in your father's career that made you want to follow?
I had originally, training at various areas around the country in surgery. I had had the opportunity to see bariatric surgery done at other institutions. And that was really in the early 80s when it was really sort of a little bit more of a fledgling specialty and was not really done very well in many places. There were complex reasons for that, some of which was it was more difficult to care for an obese patient, in our medical community in the 1980s. The technology was certainly not as good as it is now to help care for someone who's so ill. But also there were people that were sort of in and out of it, not really sure they wanted to be in to take care of obese patients, almost having to apologize if they weren't just taking care of cancer patients. If they had to take care of an obese patient, they're almost apologizing for it. And in many universities around the country, it tended to be the most junior attending in the institution would be assigned the task of starting a bariatric program.
And these patients were the outcasts. They were they were almost abandoned by the medical profession. They were most
abandoned by the profession, and they were the most difficult to care for. Not from a personality standpoint, from a medical standpoint. So you end up having the most junior attending at a university caring for the most complex patient in the building. And the results were highly variable and were not encouraging for a lot of institutions around the country to stay in the endeavor.
Did your father give you that sense of having to empower people with a weight problem, though? And obviously he feels very strongly about the discrimination against obesity.
Well, yeah, it was, coming out and finally seeing a program that had a lot of success at it and being able to really get down to the grassroots level with patients of what life was like beforehand, and then after you followed them for a long period of time with a successful operation, what was life like after? And a light bulb went off in my head that, I had just seen a different side of bariatrics when I was in my training, and I didn't really see what it was like out in a real setting where patients were getting a very effective operations that were done safely, and their life was being completely changed. Why
do you suppose there is this feeling that it's changing, but that obese people bring it on themselves, and that they should lose the weight when the studies suggest it's overwhelmingly genetic?
Well, it is. I mean, there's many studies out there that show that at least 50% of a person's weight is related to genes. One family member has obesity, one parent in the family. The children have roughly a 50% chance of developing obesity. If two parents have it in a family, it goes up to 80%. So genetics plays a big role. Now, the bottom line is if you don't eat, you're not going to gain weight. But people process food differently. They store weight. Some store weight more efficiently. And there are some good genetic reasons for it, especially, if you look back of where we all started. Many of us started started our history by running around in a jungle and hunting for food.
Absolutely.
Well, if you were able to store weight efficiently, you were going to survive.
Exactly.
Problem is, fast forward 1 billion years, and now we have McDonald's at every corner, or some fast food restaurant thereof at every corner, and we can't. Our bodies are meant to store food efficiently, and we can't process the food if we're not exercising.
How do you feel continuing the tradition that your fathers pioneered?
I feel very fortunate, number one, to have had an opportunity to see someone with such experience at this type of procedure, be able to spend time with a person like that, learn the techniques. I feel very, very fortunate to be in that circumstance, and I'm proud of the team that we've built in the years after that, the young team of surgeons that we have that are now so skilled at this, and because we couldn't do it without our team behind us. We're just one cog in the wheel.
That's true,
and the whole team that now follows it makes it so much safer.
But you have such a responsibility on you. I mean, to maintain the kind of cutting edge and pioneering treatment that he started 40 years ago.
Yeah, it is. I mean, it is a big responsibility, but one that I have now a lot of help, with both the Alexian system and many of the specialists that are involved in the Alexian systems that are experts on their own right in their field.
I've always found it fascinating. Alexian's tradition is to treat the patients that everyone else abandons. And that seems to be true with the obese patients as well.
Very definitely. Brother Phil was tremendous. I remember the day I talked to him. I had a friend come in from California, and I met Brother Phil in one of the little conference rooms. And I explained to him, I said, brother, there's a segment of our population that's totally outcast. They don't go to doctors. They themselves are almost ashamed to go to the doctor. They know for the last 50 visits when they visited with the doctor, he just said, lose weight, lose weight, lose weight. They can't lose weight. Mm-hmm. They gain weight. They have more medical problems. Now they're up to 20 pills a day or something like that, trying to take care of their numerous medical problems. And I explained to Brother Phil that this is a segment of our population that no one cares to take care of for one reason or another. And Brother said, that type of a challenge is something I like to consider. We would certainly like to consider helping those people that you feel no one else wants to help. And that is a bit of their story.
It resonated for Brother Phil that he instantly wanted to embrace those patients.
That's right.
And the results speak for themselves. Dr. Kane, where do you see bariatric surgery 10 years down the road? What changes do you see in store?
I foresee, although most of the bariatric procedures are done in what's considered now in the second millennium to be minimally invasive, I see minimally invasive procedures coming down the road that are even less invasive than the procedures we do nowadays. Many of the techniques may be what endoluminal, as they call it, will actually go down someone's throat with scopes rather than do any type of cutting on their abdominal cavity, and everything will be done with potentially with an endoscope. I see complex and varied medications coming down the road that will help with your ability to process food, your ability to turn off eating centers. There's a host of things, and I think it will be. I think we're on a trend to try to reverse this, both with education in the schools, which is even starting now, when they're talking about eliminating soda pop machines from the school. I mean, it's really turned in the last decade our awareness of obesity and the role it plays in our overall health. My generation is probably the first generation which our lifespan will be less than my father's generation.
That's unbelievable.
Whereas every generation before that has had an increasing lifespan because of obesity. my generation will be the first one that will potentially have less of a lifespan, which is, I mean, it's very telling when you think about all the things that are available medically to help keep people living more, longer, healthier, productive life, and how obesity is just eroding into that. And I know that it will be attacked by the medical community with the same vigor that they attacked other things.
Well, you have your father. If you have your father's stubbornness, it shouldn't be a problem. I mean, he champions. He's championing that segment of society, the obese, and you seem to as well. I mean, I can see that the idea that that these people are alone is something that infuriates both of you.
And it still goes on with somewhat with our medical community, although the medical community now, in their defense, has really started to embrace this as a medical problem. The problem is the access to care now is probably our next hurdle that we have to get through. And the access to care is primarily educating insurance companies, if you will, about the problems with obesity and how it will worsen our society's ability to cover the medical costs.
I mean, how quickly, there's a trade-off. You're paying for the operation if you're an insurance company, but you're reducing the high blood pressure, the bypasses, everything else. How long does it take for the operation to pay for itself?
Well, it's a complex issue. The studies show it's around 2.5 to 2.7 years that an insurance company will start to break even based on medications. Cost of the operation and compared to the cost of the care of an obese patient. The problem is the way we have it now is that insurance companies are hesitant to cover this as a procedure because the upfront cost is expensive. And they're not sure or confident that the patient will be with them in the long run. So they won't necessarily be the ones to benefit from them. However, you could look at that with lung disease or heart disease. Someone smokes. Well, is that their fault that they smoke? They get lung cancer. Was an insurance company just going to say, well, we're not going to cover the lung cancer surgery because we're not sure that gentleman's going to be with us not in our insurance system in 2 years? Well, that doesn't make any sense. But that's exactly what's being done right now in our insurance industry.
With obesity. With another form of discrimination.
Yes.
They're not discriminating against smokers or people who don't exercise or any other lifestyle issues, heavy drinkers. But again, they're just lucky to have people who feel so strongly as you both do.
I think that they will come around. I think that educating them, creating political action awareness, having patients' obesity action committees that help educate politicians, which will then help educate insurance companies to come around and realize this is really in their best interest. And if they are all in the game, everyone will benefit from it, whether it's an operation, whether it's a medication, whether it's long-term care. It's not just the operation that makes someone successful. It's a combination of an operation, the medical care and the medications, and then long-term care that really helps keep a person on the straight and narrow from an obesity standpoint for the rest of their life.
It strikes me this is so much more than just an operation to the two of you. This is it's almost a mission to help these people, and in every way. Well,
the impact is so huge that you really see it when you do when you have the type of program that we have. The impact, as my father had stated earlier, is so huge to these patients that it's just hard to turn away from them. And when you realize what can be done for someone when they're in their shell and suffering from medical problems, to the other side of the coin for them.
Can you describe how do they blossom?
Well, these people have a myriad of talents, that at times are just buried under depression and shame. And you sort of lift that veil from them, and it's just amazing the levels of talent that are finally sort of displayed. They're there, but they're almost afraid to get into a venue to display them.
They hide their personalities behind whatever because they're so ashamed or whatever. And you've seen that, Dr. Kane Sr. as well.
Unbelievable.
And you both get, I'm told, an unbelievable amount of gratitude from the patients whose lives you've changed. How do you feel about that?
That is one of the big payoffs of doing it. The patients so love you for helping them in an area that no one else was going to help them. They felt they were thrown overboard prior to this procedure. When they have it, and they're back in society, and they're doing the little things. They just wanted to go to the parent-teachers meeting like everybody else. Yeah. See, they just want to go out on the baseball field when the little guy is playing baseball. That to them is a great joy in life. And the fact that you did something that makes it now better for them, it's they just can't be thankful enough for you, is about the way to say it.
Well, you created an incredible legacy, and now Dr. Kane Jr.'s got to continue that legacy. That's quite a responsibility.
He'll do a better job. He'll do a better job than that.
Oh, well, thank you so much for talking to me.
Thank you
I really
much for having
appreciate
us.
it.
You bet.